CDC Director Robert Redfield surprised people during a Senate hearing by saying a mask is more protective than a vaccine and that the drug's rollout will be so slow, some Americans will have to wait until this time next year to get one. Only hours later, President Trump contradicted both statements.
I think he made a mistake when he said that. It's just incorrect information. And I called him, and he didn't tell me that, and I think he got the message maybe confused. Maybe it was stated incorrectly.
New task force advisor Dr. Scott Atlas told reporters all high-risk people will be vaccinated by January and everyone else by the end of March.
Within the first 24 hours of FDA's approval under an emergency use, we will have vaccines being delivered within the first 24 hours. And it will be done at virtually no cost to Americans.
Initially, the military will help distribute the vaccine to 51,000 outlets nationwide, including 14,000 health centers in minority areas.
Number one is safety, number two is speed, but you can have perfect safety and have much more speed, and that's what we did.
The president accused Joe Biden and Kamala Harris of playing politics by scaring people who need the vaccine.
I'm calling on Biden to stop promoting his anti-vaccine theories because all they're doing is hurting the importance of what we're doing. And I know that if they were in this position, they'd be saying how wonderful it is. They're recklessly endangering lives. You can't do that.
Meanwhile, pro-life advocates continue to express concern about vaccine manufacturers using unethical practices.
Some of them have chosen to use aborted fetal tissue in the production of the vaccines. How are you balancing out to be able to make sure that there will be an ethical alternative for individuals that don't want to take a vaccine that's also produced using the tissue of an aborted child?
Experts say eventually Americans will have their choice of vaccines. Indeed, the president said a number of different vaccines will likely be approved.
More on this story, Lori Johnson joins us. Well, can you answer Senator Langford's question? Will there be an ethical alternative that won't include aborted fetal tissue?
That's the hope, Gordon, and it looks that way right now. We know that right now it appears the most promising vaccine is one that the president was talking about yesterday, the Pfizer vaccine. We know that that was not manufactured or developed using fetal tissue from aborted babies. And yesterday during the news conference, he hinted that Pfizer might be the first one over the finish line by saying that he's constantly updated on information about how the trials are going and that Pfizer's looks really good. He also said that Pfizer is spending billions of dollars right now to manufacture millions of doses based on the information coming from their trials. And also separately, the CEO of Pfizer said recently that it looks like by October, they will know definitively whether their vaccine is safe and effective. And we also know that Pfizer recently expanded their phase 3 clinical trials from the requisite 30,000 to 44,000. This is good because it also includes a lot of minorities. And we know that people who are African American and Hispanics are disproportionately affected by the coronavirus vaccine.
Well, let's talk about the safety of it. I mean, there's some that are saying the rush to complete a vaccine may compromise things. And I, for one, don't particularly want to sign up to be a guinea pig. Can people actually trust what's going to be released?
Well, Gordon, whether it's a vaccine or surgery, any medical procedure should be considered using two key elements: the risk and the benefit. You have to weigh out the risk and the benefit. And health experts say regarding the coronavirus vaccine that the benefit is very high and the risk is very low. We know that in an unprecedented event, 9 major vaccine manufacturers, their competitors, remember, they banded together recently to assure the general public that they will not request an approval by the FDA until the standards of safety and efficacy meet their golden standards. They're very high standards. And so also separate and apart from that, we know that there's an independent review board of medical experts that are not associated with the government or the pharmaceutical industry that review all of the data and make their recommendation to the FDA. This is standard protocol. Usually the FDA follows their recommendation.
All right, Lori, thanks for your insights. And for the viewers, we will keep you posted on this and on this story and ethical alternatives. What is the latest information? Lori Johnson will keep you updated. All you have to do is track into cbnnews.com.